And speak on this topic, and we're also excited for the dialogue. This is a topic that, of course, continues to evolve, very critical to our industry, and one that we are quite passionate about. So, as we get into this, it's intended to be interactive. We look forward to it, and again, thank you for spending your time. For those who have not been able to join us during this live session, we will have a recording. And I believe that will be distributed to everyone who's enrolled or registered. And we're always happy to have additional conversations after. So without further ado, perhaps we'll get started here. A quick introduction. My name is Kelly Tao. I apologize I'm not on video. I'm having technical issues, but hopefully you can hear me okay. I lead the health plan practice for ZS. I'm joined by two very esteemed colleagues. Willem Conders, he is our enterprise lead of data strategy and governance for ZS. He has done a significant amount of proactive thought leadership in the space, as well as serving over 25 clients globally across all sectors in these types of topics. And we're really fortunate for him to bring kind of all of that perspective today to apply to health plans. As we all know, I think health plans have a lot to learn, perhaps from other sectors as well. We also have Amy Goodman. Amy is one of our health plan strategists. She leads one of our critical accounts in the health plan space, and Amy is a practitioner and a lifelong learner of data governance and how it applies. Um, we thought this would be a great session to have amongst many. So for those of you who know ZS, we are a global healthcare consulting firm. We're about 15,000 people in 40 offices worldwide. 95% of our work is in health industry. And the core competency of ZS is fundamentally data analytics and insights. So not only is this topic core to our DNA and how we think and how we work with our clients, it's also core to the future. When we think about health plans, and we'll talk a bit about this, we think that there's an amazing opportunity now for health plans to rethink and ultimately modernize how they think about data governance. At the core of that is we believe the health plan of the future is fundamentally grounded on not only having the right information and insight to influence the healthcare ecosystem, but also the right entity that controls the incentives. So we believe health plans continue to be uniquely positioned to drive change in the future, to have the impact we want for U.S. healthcare and beyond, and ultimately to drive better outcomes for stakeholders and for business. So with that, we do have a bit of a planned agenda today. For about 15 minutes, we will just share that perspective. We will share why we think data governance is so critical to health plans, and more so now than ever, and why we think there's an opportunity to modernize more so now than ever the playbook and the capability set, just given the onset of many trends and opportunities. And then we have a bit of a Q&A. I think a lot of people had submitted questions in advance. These questions are opportunities for us to perhaps address those in a bit of a Q&A session. And of course, as I said earlier, we're very open to just ongoing questions and dialogue throughout this session. So feel free to keep them coming. I will moderate that. If you want to put them in the chat or even just send me a message directly, we'll find the appropriate time to feather them in. So with that, thank you again, and we'll get started. Amy, do you want to kick us off?
Great. Thanks, Kelly. Good afternoon, everyone. I want to start by setting some of the industry context here specific to health plans in the U.S. And as Kelly was starting to share, even today, the role of health plans and the capability of health plans is quite different compared to what we saw 10, 20 years ago. And we expect different from even how they're going to evolve and how they will look 5 years from now. Health plans are facing a lot of significant market disruption from tech-led new entrants, from rising consumer expectations and platforms that deliver on that, to new economic models that break down historic silos across the healthcare industry, reinventing both a clinical model as well as who's bearing the risk and financing the care. And as we think about how health plans are going to evolve to stay ahead of that change and to continue delivering value in the marketplace, delivering value in a world that's heavily consumer driven, digitally connected and tech scaled, it becomes more important than ever that health plans deliver on their core competency related to data and extracting value from data in ways that only health plans can. Many of our clients and our close friends in the marketplace are already recognizing the opportunity that data analytics and digital can unlock for them and are actively working to deliver on that value. Some quick examples to bring this to life, can be around, for example, care evolution and using predictive analytics and machine learning to enable condition-specific, personalized consumer engagement and care enhancement. Driving toward, that famous quintuple aim around driving better health outcomes at lower, more efficient costs. Data and analytics to understand the member and their healthcare journey is critical to allow them to do that. Being able to identify at-risk members and engage them in the right way at the right time to drive higher quality, lower cost care. Another consideration is around administrative efficiency. An extremely tough economic environment for health plans in the U.S. economy today, and increasing and leveling up the role of automation and human-in-the-loop AI tools to eliminate manual tasks and improve admin cost performance is critical to financial sustainability for health plans. And data is the foundation, for those tools to work accurately and effectively. It needs to be running on top of well-governed data. A last example I'll highlight is around the transition to value-based care and facilitating more meaningful patient-provider engagement experiences through a digital patient journey, connecting the dots of data and experience at multiple points in the healthcare ecosystem and driving that collaboration and ultimately more efficient, high-value care between health plans, provider, and members. And so data is the foundation for those three and many other imperatives for health plans to continue to be successful today and beyond. And so data governance is critical to be able to extract that value from the data. Data is core to business model transformation, and if it's not accurate, reliable, and well-governed, health plans are not, well-positioned to be able to leverage data as a strategic asset in that way. Willem in a moment will speak about, offensive and defensive capabilities, but data governance also is critical to enable more efficient administrative performance and avoid the risk of data incidences that can cause potential regulatory fines, or reputational harm. And so I think with that, I'm excited for the conversation today and to dig in a little more deeply on what data governance can look like for our health plan and what are some practical tips for bringing that to life and making it real. So with that, Willem, I will pass it to you.
And I'll try to keep it within the hour, more or less, because I would kind of get to an area now that I'm super passionate about, spent all my life kind of in this area of strategic data enablement and very often specifically data governance, which has a very bad reputation, right? Which I almost sometimes take personally, but just has to do with the way that, in the past, there was a recognition that data is important and along similar lines that Amy just outlined, even though ever more important even today. But like a lot of times it didn't work out. A lot of times it didn't try, right? So a lot of times like the actual impact wasn't actually it wasn't materializing in the respective case studies. And so I wanted to kind of unpack a little bit what that data governance is about and how you can think of this in a way that it can drive value. And specifically wanted to highlight a set of foundational data capabilities that you can kind of see in the middle of this picture, right? You see data governance, you see data quality, data catalog, and then a couple of more, where data governance is one of these capabilities on its own, right? So like it helps to establish these expectations about how do you manage and govern data, and then specifically what are the roles and responsibilities associated with that, and how do you kind of drive some kind of consistent activation of that through your respective organization. And so that's almost like, we put it at the top here because it actually it doesn't own entirely or define how you would to do data quality, but it really does help to for example, clarify like who's responsible for it, who's accountable for it. Do you do it centralized? Do you do it decentralized? And so finding those things out, like defining those foundational data capabilities that you see in the middle of the picture, the key message that we'd like to leave you with through this page is that if you do this right, if you pick the right foundational capabilities and you configure them in the right way, it does help you both defensively and offensively, right? There's kind of this apparent perception out there that if you do data governance, that it's going to slow things down, right? It's just going to be taking time. It's, if you do that, like you can't maybe be as innovative. But just to kind of unpack that a little bit further, like some of the defensive capabilities or defensive objectives you may have, may be about regulatory compliance, right? It's in health plan sector very important as well, like tons of super sensitive information, patient information, personal information, right? PHI, PII, like knowing where that data lives, having it classified and making sure that the right people have access to it, but only the right people, that you also share it, with the right external partners, but only subject to the right kind of governance controls. All of these things are defensive data capabilities, right? They help protect your data, they help protect your reputation, they help protect you against regulatory inquiries, reputational damage, and things like that. But I think fewer people truly realize, especially let's say people who may be in a bit more of a business-oriented role and who may have to play a role in kind of making this work and potentially funding it, don't realize that if you get it right, it actually helps you unlock a lot of offensive data capabilities or objectives as well. Because who doesn't know, or hasn't heard a lot of these anecdotes or complaints where you have different, digital or commercial teams or people engaged in, driving a better experience for the members or for healthcare, that they don't have the right data. It's kind of this vague, hard to find, like the data is not there, I can't trust it, or I can't find it, can't access it. It's really the part in the middle, again, like where you have a minimal understanding of what is this critical data, where is it, how is it classified, and what is appropriate use, that enables you to confidently democratize that data to these teams who are playing a role in a much more offensive role as well. Like there still is a tension sometimes, like you can lock everything down and focus more on defensive. That will go against the offensive and vice versa. But like for the most part, if you do this right, and the approach that we'll talk to you about, it actually enables you to do very specifically both, like objectives on both sides. Okay, I'll keep going, but as Kelly said, if there's any questions or clarifications, feel free to keep them coming or have them come in. And so, if we think about data governance, that's that's a big topic. A lot of things are included. I actually pulled it off my shelf here. I don't know if you guys have seen it. It's kind of the biggest, like #1 worldwide Damadium Book 2, the Data Management Book of Knowledge. It has, I just checked, about 600 pages. Like where do you start? You can't do all of that everywhere, right? For all data across all of your teams. And so what we've worked to refine is a playbook that really focuses on, or helps you focus on, implementing those data governance principles in a way that is aligned with the previous visual, right? That you do it once, but you do it in such a way that it can be reused across your organization. And you can also do it for your most critical data, right? Not necessarily for everything, but like for your most critical data, and specifically for the data products or assets that you identify. And so I'll talk through this in a little bit of detail. If any of you who are listening today live or on the recording later are interested in more of an actual, deep dive in any of these steps, feel free to reach out. But I'll kind of step through like what that approach, what that playbook really is, right? And maybe before I even do that, it's good to understand that this playbook, this approach really builds off of a domain-driven approach. And so what happens here is that, again, instead of you managing all data everywhere all at once, you carve out or you divide your organization into usually between 10 and 20 domains, right? It could be member data, it could be claims data, there could be employee data there as well. And those domains you kind of described up to some level, and you can prioritize them. so that you can figure out which of these could be maybe the first one or maybe a handful of the first ones where you would actually activate data governance. And so what does that mean? Well, activating data governance is what you would do by following a playbook like this one, right? So you would start at the top, right? Kind of the brownish orange color at the top, where you would confirm a domain and its owner, you define the domain boundary and inventory, kind of roughly what's in there, and you define what's important here. Like that's that first step. It's not always that quickly as I make it maybe sound here, because you do have to find an actual owner and somebody who's willing to lead this. So that might actually take some time. But that's a very critical first step, to actually establish a domain and have it defined, right? What's in it, what's outside of it. Now, once you have that, two parallel paths are opening up to you. Firstly, it's the part in the gray, right? These are the asset-specific activities, where the asset here is a data asset, or sometimes referred to as a data product. We're basically saying, like, within a given domain, say member data or say claims data, you would figure out like sometimes it's really just one, but usually it's kind of a small handful of most critical data assets that you have. And so for those, you can have a couple of steps to describe them through their critical data attributes, for example, so like a claim ID, claim description, claim amount, things like that, and capture some very strategically chosen, minimally required metadata, right? So that after that step, you now know what your domain is. You also know what the kind of the high level your data assets are, which then actually enable you to go into those 4 boxes in the gray space around lifecycle management, ethics, privacy and compliance, protection, security, and quality management. Like that step I just described is really key to the center of the previous visual, where something foundational is now used to actually drive a lot of other foundational capabilities all at once, right? So because again, if you know what the data is, what it's about, if you know its definitions, now you can actually create data quality rules, right? Now you can set up protection or security controls, because now we know what it is and who should be have access to it. Ethics, privacy, and compliance benefits from that, right? They actually work very strongly together, because a lot of ethics, privacy, and compliance is about ensuring that only the right people have access for the right reason. And the lifecycle management, of course, to identify where is it coming from, it's captured, it's stored correctly. All of that depends on a minimally required understanding. Then quickly, while you step through in a given domain, right, in your health plan or organization, while you in a given domain, you start doing that work, you can also operationalize the domain itself, right? Because like as unfortunately, maybe for some people who are hoping to get a solution one and done, like data governance is a journey that will never end, right? You will have new data, your data will change, your usage will change. So your domain will need to be active after you do some of the initial hard work to bring these assets under governance. And so when we think about operationalizing a domain, it's like making sure that there's an active community that now makes sure that those assets continue to be governed adequately. So think about a couple of forums, think about reporting that usually actually takes the metrics from the other capabilities mentioned on this page, some training and change management, after which all of this feeds into a steady state, right? So that's where, if you've done it right, actually the work isn't all that much, right? And one of the other questions we get in many client organizations, or many, especially those starting on their journey to do a lot of this data governance, is like, how much time is this going to cost me? Like, how many people do I need? And so while the answer is that you typically do need some sense of some measure of dedication, to a very large extent, like data governance should really be about working with people who are already doing a lot of these things today in their day-to-day jobs. Like they already have data. The system's already there. They already work with it. They already share it anyway. But to help teach them, help bring them to a standard, to do that subject to a couple of policies and standards, right? That's really what it's all about. And so that's the playbook that we've now implemented across like we created it based off of the experience of a couple dozens of clients, and we've now successfully implemented it in the health plan organizations as well. And so based on that, wanted to bring this out today to this audience and share some of the kind of some of the specifics and some of the impact that this has had, which Kelly, Amy, was pretty much what I was looking to cover here.
Yeah, maybe thank you, Willem. So maybe for the audience, just to reground this, again, this is about a modern approach to data governance. The fundamentals, it sounds like, Willem, haven't changed, but it's really the application and the mindset we take to ensure that they are valuable and achieving the needs of the future is probably the aspect of how this has become more modern. If I go back to the offense versus the defense, this gets back to health plans, right? For all of us that have been in the health plan world for a decade or two, data governance was largely heavily on the compliance, regulatory, and risk perspective, right? We've got PHI, we've got a lot of very sensitive transaction data. We have high volumes that are fragmented across the system, and ultimately we're talking about people's healthcare. So the desire was appropriately focused on how do we just protect, how do we protect that data? So a lot of the same disciplines apply, but when we talk about the future, right? The world is littered now with how do we apply AI? How do we digitize the entire member experience? How do we channel units of care to a micro level personalization across an ecosystem, by the way, of healthcare that's much more beyond just the traditional provider and hospital system, right? Is now infinite levels of care delivery units and care management units out in the market. The fundamental position of health plans and the value that they can create for the industry is very much now grounded on information and data. And so we hear a lot about from our clients managing data like a product. We hear a lot about data as the new currency for negotiation, not just with providers, but with employers, with government, with other plans, with individuals, right? With other kind of partners and vendors in this a wide sea of healthcare innovation. So it really has become such a high priority, while it's still grounded in perhaps some of the old thinking of what the value of data governance is. So with that, I think it'd be good to maybe get into some questions. As I mentioned earlier, leading up to the session, some of you have submitted some questions I think are really appropriate and grounded here. So again, if anyone has questions based on what you've seen so far, again, we have a whole playbook that sits behind this, but feel free to put them in the chat, and we'll incorporate them. I think we've got about 20 more minutes or so to get through some questions. I'll start with kind of the macro one. When back to as health plans have evolved, and Amy, maybe this is a good question for you because you sit in doing health plan strategy and you see all the implications on data. What kind of new governance is needed? When Willem talks about domain centricity, what are some of the things that kind of rise to the top? Where are you seeing a lot of senior leadership mindset starting to change their attitude towards data governance?
Yeah, thanks, Kelly. As we think about health plans playing in this new era and starting to think about themselves more and more as analytics companies, it's not about having the data. They've had this data in different places and different silos for years, although in the digital age, more and more, data types and sources become available as well. So it's not about access to data. It's about how do you connect the dots across data silos in a timely manner to power the kinds of analytics that can drive smart business decision making, as well as appropriate and timely clinical interventions. And to do that, the first step for many health plans is to even wrap their arms around what are the data assets they have where, what definitions are used, how do we align our definitions across different business units that may be touching similar data, and connecting the dots between folks in a health plan who are, quote unquote, producers who work with the source systems for data, the technical teams, and then the different downstream users of the data. And so it sounds simple in a way, but it also can be quite complex to actually understand in a clear way what data assets and data sources sit where, and how can we connect the dots across those different silos of data in the organization.
Yeah, that makes a lot of sense. Perhaps a corollary to that is kind of how Willem started this session, right? I think Willem, you kind of made a little bit of a joke, self-deprecating perhaps, that sometimes data governance is seen as a little bit of maybe an annoyance thing or an afterthought. And when you hear Amy talk about how the executives and the health plans are thinking about the value of data a bit differently, has that translated, Willem, into a bigger demand or changing demand for data governance?
I think so. I think you'll also see that with every new wave of technology, there's kind of a renewed, demand for, I want to use it, right? But I can't if I can't put the data in, right? Gen AI may be one of the latest one. There were previous, analytics and AI ones in the past. And then the other thing that I would mention is that is kind of this whole data product or data asset approach. Like what I think you'll see out there in the marketplace is that looking at data as an asset is something that's really been picked up again and reinterpreted, and specifically also to take data governance and implement that for specific data assets and data products. And so why does that matter for these business folks that you kind of refer to? Is that like this is like really where we go away from asking the technical questions around metadata and quality, and we really start to attain a product mentality, right? So like somebody owns a part of data, and you ask yourself the question, who are my consumers? Who are actually using this? And not just this year, but also next year. Like there's even some almost like fashionable trends to this. Like how can I do things to this data so that I can actually enable the impact that my downstream users can have through that? I think that type of, renewed, I would say, revamped view on data governance has produced a ton of interest and a ton of impact and momentum actually in how kind of some of these analytical technologies that are brought to these organizations are empowered and enabled these days.
Yeah, that also resonates. I think we feel that from a lot of our clients. There's a fundamental movement. I think even the language and the importance of that is starting to be elevated, right? As opposed to just a line item in a different initiative, they're starting to bubble up and be kind of priority initiatives. So from a strategic perspective, that makes a lot of sense. I would maybe my second question for you guys is, and I'm sure a lot of people on the call are dealing with this. While people are aligned to the strategic value of data governance and the enablement value of data governance, health plans are under pressure, right? Amy, you opened your opening slide had a whole piece around administrative cost and capacity to invest. So how does one get started, right? How does one actually translate this very strategic need into a business case or into a value proposition that does get the funding, to do something that is more modern and domain centric? Amy, in your conversations, I'm curious, where have been the critical proof points that in a business case or processes that have unlocked this kind of journey?
Yeah, I mean, the value and the business case for data governance is an important question, especially, with the tight economic climate. Investments to mature data governance are, looked under the microscope, along with many other investment decisions that health plans are making. And so the business case is multifold. Some of it can't be counted in hard dollars next month, but the executives that we're talking with, understand that it's real and it's value that they're going to capture as an organization. So there's kind of both positive value from enabling the use of data as a strategic asset and all the multiple kind of revenue and medical cost implications that can come from using data more efficiently and strategically. There's also significant admin cost savings to be had, which health plans certainly can quantify and capture tangible value from in terms of the hours. And, in many places we hear about analysts spending significant time trying to understand data, working and addressing quality checks, and connecting the dots due to kind of lack of transparency, lack of clarity. Some simple analytics and data-driven decision-making can often be much more time-consuming than it would be when empowered with modern data governance and data platforms. And then finally, poor data governance leaves health plans exposed to significant risk, both in terms of regulatory fines from actual breaches and compliance challenges, as well as the reputational risk that a health plan can play if there is, a notable mistake in which data is shared in the wrong way with the wrong person. And so having that level of control and transparency on the data that's in-house, when and where that's appropriately being shared externally, and making sure that it's all running tightly and in a compliant way is really critical, with strong business case justification behind it.
Yeah, that one makes a lot of sense too. I think it reminds me of performance guarantees to some extent, right? If we are able to quantify some of the real financial risks that not having data governance exposes us to, that can certainly catalyze a business case. Willem, I'm curious from your perspective, given you've done data governance for so many different industries, and some of these industries are, they were digitized much earlier than healthcare, right? And whether you're talking about financial services or retail, or even in different parts of healthcare where, digital health tech and med tech have become the new wave. Any lessons there of that might be relevant to how you measure ROI of data governance in health plans?
Absolutely. And then that's a good news, right, for health plan and a lot of other either sectors that are kind of putting more efforts towards this, or organizations that are kind of starting with this as well, which is that there's a very rich set of best practices and methodologies out there as it comes to the quantification of value as it relates to data, right? Like you'll see some of the international organizations out there have started to refer to this as data ROI, and sometimes actually the quantification of actual data, the value of actual data as well. And so there's a ton of approaches out there that become very specific in how all the things that Amy had mentioned from a health plan specific perspective, but how you have specific methodologies out there that would help you put an actual, sometimes dollar number, sometimes kind of, non-dollar numbers if it goes about kind of member experience, for example, or the quality of the healthcare. But like how to be very specific and nonetheless to quantified about it. And I think maybe the let's say the big change in almost mentality sometimes that kind of comes about is that you move from data governance in the past where we would talk about, I've got 2,000 systems cataloged. I've got these many data quality rules in place. I've seen this a few places, 5,000 data quality rules. I have 99% completeness. It's like very much focused on kind of the governance specific capabilities. Like a lot of these metrics, a lot of the justification of the work that was done was in terms of the scope that was covered versus this kind of more, it sits within a domain and sometimes even a data mesh kind of context. If you have these data assets or products, like as a data organization, you can start saying things along the lines of, and I'll make up the numbers, but like, we have identified 15 critical data assets right now. About 500 million of our incoming fees or revenues are directly influenced by this data. 25,000 of the specific members are depending on this data because of a particular service process. Like it really starts to enable you to tell the story in terms of, I've got a portfolio of data assets, right? Of really critical data that is helping me fuel specific business processes and use cases, which is an entirely different story than trying to explain why you need $500,000 for a particular data catalog or data quality tool because certain data is bad, right? The story is entirely different for the folks that actually feel and understand the impact that it will have in real life.
Yeah, that resonates as well. I think the entire industry, not just health plans and different payers, but healthcare in general is getting more and more entity and persona centric, right? And so I think part of what you're getting at is tying it to the end-to-end experience as opposed to the data itself is pretty key. I think that gets us actually into another category of questions. So if you've got the strategy and you're able to finance it to some extent, Willem, you started this whole thing with leading with the domain, right? Being domain centric in how you approach this. And I think most people working at the intersection of digital and healthcare today subscribe to that, right? We talk about in some ways just being business centric, being use case focused, and perhaps designing for the long run, but executing to the near term. And I think all of those kind of fit in this thematic approach. Um, the challenge I think many people on the call probably face, if they're like a lot of our clients, is just the fragmentation, right? It's easy to
Right.
say we're going to be member domain, but member domain is not simply the enrollment system or eligibility system. Member domain is the member data that goes through dozens of systems of record, even more systems of insights that are way out in the ether. Some enterprise tools and some um, tools on someone's laptop. How do you think about orchestrating that? Right at the end of the day, you're trying to be domain centric, but knowing how fragmented that model is.
Yeah, I think it's a domain-driven approach that really enables you to hit the right balance between being consistent, right, and confident about certain behaviors, practices, and standards that you would like to see and enable across these different domains, and then enabling and allowing, and maybe even empowering some of these domains to actually take the best of that and interpreting that for their respective domains. So if we talk about key roles like a data owner or a data steward, for example, or what data catalog are we going to use? It would be terribly ineffective if every, let's say, domain would have to figure that out on their own. Like it would be a mess. And so if you can help with kind of identifying, let's say, one data catalog, you can help clarify what's the data owner, what's the data steward, and you can give those as almost levers to these domains, and indeed not even just starting with here's all the stuff you must do, but like actually you presenting this as an opportunity very often to help address like data pain points that have been there for years, right? And also which may actually sit in other domains, like where you have a different interaction model appear between the different domains that are dependent on each other for critical data. I think that's where a lot of the magic is, if you get that right, like where you get a simplified enough, powerful playbook with a minimum set of capabilities that you can help your domains take charge. That's where the power is. Because you still want to recognize that, again, these domains are not randomly drawn, right? They tend to correlate with actual organizational lines. They correlate with a logical understanding of that type of data, and that data ownership, let's say, is something you cannot delegate. Right? You can't take that away. You can't centralize it. People found out very painfully so in the past that if you try to do these things in a central team and you take the data away from the teams that actually produce and consume it, you're gonna lose touch, right? And I think that's kind of where, at least in our personal experience, that's been the real key and joy actually to do.
Yeah, I think that resonates quite a bit. I can recall several clients, probably maybe around a decade ago, right, where a lot of claims consolidation was happening, a lot of membership consolidation, all really kind of a little bit of a fallout of Obamacare and the ACA, just this need to get into more streamlined, single core admin set of processes. And then to your point, there was this rise of central enterprise data governance teams, right? And every client I knew had like an edge team, enterprise data governance of some sort. And to your point, I think it was great at setting some policy and process, but very difficult for the business to actually apply. And if
Yeah.
they did apply, it was a big heroic effort, and then it fizzled out pretty quick, which then eroded the ROI. Amy, I know you've applied this new modern playbook to your own client. When Willem talks about data stewards or data owners and all of these terms that seem to be a big change, right? It's a big change from what health plans used to think about as more transaction centric into more experience centric. What have been some leading practices you've seen around getting the adoption of this?
Yeah, thanks, Kelly. I really appreciate that question because adoption, that's the $1 million word in data governance here. In some ways it's easy to define what good should look like, but to actually change behavior in the complicated day-to-day work of different health plan stakeholders, that's where we do see, many health plan clients being not as successful as quickly as they'd like to be. So how to drive adoption? Number one, it's around really enabling the business and domain leaders to take that accountability themselves. We wouldn't want data governance to be something that a team off to the side implements for the organization. We want to give those domain leaders the tools and assets and structure to take on that accountability and responsibility themselves. And that's the playbook that Willem was talking through is one way that we do that. Executive sponsorship is critical as well to kind of set that expectation that it is something that folks add and incorporate into their day-to-day work and responsibilities. Two other points I'll add, so on the one hand, accountability is critical, but we also recognize that folks are very busy and there's often resource constraints and different timeline pressure for critical, other business priorities and initiatives. And so while we want to drive the accountability, we also want to make it easy as possible and practical for those stakeholders. So one way that we do that is bring human in the loop AI tools and automation to develop drafts for them to validate rather than starting from scratch, building in automated processes, smart intelligence to limit the kind of the amount of actual kind of work that folks are being asked to do. And then, so that's kind of an answer about tech assets and capabilities. There's also an approach that works well around process and how do we adjust current meetings, current scopes of responsibility so that this phrase governance by design. Data governance is now baked into some of the current state operations and activities and responsibilities rather than thought of as something new and off to the side as a separate responsibility. How do we make minor tweaks to current state to be able to reflect more mature governance practices?
Yeah, thanks, Amy. It is nice to hear, right, that your client has been able to apply some of these because, again, like you said, it's not new, but a change in mindset and perhaps a more purposeful application of the playbook can yield, maybe a different culture. I do want to touch on it. You bring up AI, and that's the buzzword of the last couple of years. And Willem, you mentioned earlier, there's all sorts of new tech, right? That's why a modern playbook is actually more achievable, perhaps, than it used to be. Even if we knew what to do before, we didn't necessarily have the scale. Maybe can you shed some light on how AI or other tools have enabled, perhaps under-resourced organizations in the past to now actually achieve some of the maturity levels that we're talking about?
Absolutely. And in a general sense, like any data governance that anyone does today should be tech enabled, right? If any of you have hereby an open invitation is doing this and feels that, it feels that, it feels, manual or anything like that, like reach out and let's talk. Because like any of this data governance that we talk about should be tech enabled for various reasons. One, as Kelly, you were alluding to, it goes faster, quicker, and actually better. Like it's actually better than a lot of human hands on keyboard as well. Two, it actually you have to maintain it too, right? So if anything you do that isn't appropriately tech enabled, and you put it in, spreadsheets, SharePoints, etc., emails, meetings, a year from now or sometimes even quicker, like it's just not relevant anymore. Like it's not up to date. You have to do it all over again. So if I were to look at probably the three biggest ways that I see AI and technology, right, play the biggest role is through automation of different steps. It's through workflows, and it's through democratization of the eventual data, right? And so real quick, the automation is maybe the maybe the most exciting part. Like Amy, you were just alluding to it, right? So like anyone also here who's still hand typing definitions for data, be it the technical or of the business ones, like stop what you're doing right now, like that, because that is something that you can do with various actually open source tools even. I'm sure your organization has some availability as well, some tools as well available. It goes super fast. Like it requires some context, but if you feed it correctly, it goes, it's right there. And like all your business stakeholders, like Amy mentioned, who you would like to focus on actually focusing on the data, right? What do I need? And I focus on actually using it and bringing it up to a certain quality level, they don't have to spend time redefining it. It goes very fast, as one example. There's other automations as well around like documenting lineage and observability more generally, but like that's one bucket. Second, real quick, are these workflows. I know this. I bear the scars, at least the mental ones, of having to do data governance, using Excel, emails, and meetings as the core vehicle. If you have a lot of platforms out there where you can actually define domains, like define your assets, define your owners, define your stewards, all of this now becomes part of the actual process. And I think it also reflects that data governance is not necessarily a static endpoint, right? It's very much alive. Your data, it's as alive as your data is. And so the workflows really help you do that. And workflows have been around forever, but I think that you'll see that a lot of the technology has gotten even better to using them. And then finally, real quick, the democratization of all this good stuff. Like I have a horrible, horrible anecdote from a different client where we had to go in after the fact, I will say, but they had had a multi-million-dollar journey every year, right? Multi-million-dollar every year invested in this kind of data governance stack. They would had tens of thousands of fields or technical metadata completed, and when we actually eventually tried to ask some questions around, so who actually accessed this, right? Because it was done for regulatory purpose. They had 2 unique business users in the previous 6 months. That's awful, right? And so like the part where technology really helps as well is to take all the stuff that you learn, all these definitions that you put in place, these assets that you identify, the quality dimensions that you put in there. It really helps to open up that offensive part of the puzzle we saw earlier, right? So like you now take all of this and you present this back to people who actually want and need this data. Think of also here about like a lot of, if it isn't for your existing people, people come and go. Like, and so if people come into a new role, like they might know your sector, for example, but they might know your company. And so quickly learning what data is where technology is, the marketplace, the catalog is the #1 way to go to help facilitate that. So could probably talk for another hour about some of these things, but those, Kelly, are some of the main things that at least excite me about this.
Yeah, no, it certainly takes it to a new level of what's possible. I think in some ways, and I'm going to date myself a little bit, but it reminds me
Yeah.
of testing, right? Like back in the day for large enterprise systems, you would 20% of your budget that you were asking for was around getting, dozens and dozens of testers for system testing, integration testing, smoke testing, all of that. And probably 15 years ago, the testing automation journey began at larger adoption, and now we can test at 100% with very little incremental labor. And I kind of think of that as when you describe this democratization and automation of data governance, and how you essentially embed that into the day-to-day workflow. I know we're getting close to the end of time. I don't see any additional questions in the chat here. So, again, I welcome anyone who does have any to ask them now or find us after this. Again, this is a topic that we are very, very passionate about. It's embedded in a lot of the work we do for clients. Just like, our speakers here have said, it's not only are we doing it as a data governance initiatives and programs, but we're helping them become culturally embedded into the day-to-day processes of our clients, because it has become core competency of our health plans. It has become the currency by which advantage is created. So we're very, very excited about, again, not just what we've done, but what the future reveals here. Maybe I'll leave our speakers with one last question. It'll be a provocative one. I'll start with Amy, but I'll ask the same question both. What's the one thought you want or hope the audience leaves today's session with?
Thanks, Kelly. I would say start somewhere and don't let the perfect be the enemy of the good.
Oh, shoot. Now, what do I say?
And call Willem.
Maybe. Yeah, I think so. I mean, I also, when I think about data governance, like I also just think about like positive energy, like see the fun of this stuff. Like it really has, there's a bad reputation, and some of these things will remain tedious for a while. But I would just also take away from this that the journey that we've had with like several of our clients, including in the health plan sector is that it was actually enjoyable. It was fun. You was like, how do you take some of these things that people in your organization have been complaining about, well, a long time, let's say, how do you take them and actually drive meaningful change, right? And then actually you can hold yourself accountable if you do it the right way afterwards, right? 12 months later, and then basically do a review of sorts and see like, so what was the difference, right? We said that there was an impact on the defensive and the offensive side. Was that really the case? And the answer was yes, it was, right? And so like I think it gives a hugely satisfying feeling. And so I think maybe if I would mention then one thing, one there is to kind of be inspired by it, hopefully.
Yeah, thanks, guys. I will also reflect on this one. I think it gets back to where the need for this is really surfacing. And the easy one is we're all dealing with AI. Every single one of our clients is trying to figure out, how do we get on this AI journey? How do we apply AI for the benefit of our members, benefit of our providers, benefit of our stakeholders, and benefit of our employees? And there's no shortage of AI applications and technologies and energy, right? And interest. But often what we find is the data is not ready. And so if you want to transform healthcare with AI, which everyone is trying to do, it does come back to the data. And so that's what makes data governance very exciting. That's why this modern playbook is needed. And we hope you guys take that away. Thank you for spending the time with us. This was a great conversation to have. We will have additional ones. Again, we're on our own journey in evolving our perspective and in our impact in our place in this world as well. I want to thank Willem and Amy for sharing their expertise. Again, if anyone has any questions, please feel free to reach out. That's what we're here for. Thank you very much.
Thank you all.